Are there any two words that strike more terror into the hearts of covered entities than the words manufacturer restrictions? If your answer was no, then I 100% agree with you, but we need to understand how we got here. One of the biggest challenges within the 340B program is that the 340B statute is very brief. It only addresses very specific operational elements of the program itself. So it defines who are eligible covered entities, it defines the manufacturers who are included, auditing parameters, as well as how the 340B ceiling price is defined, and some of the operational and regulatory authority of the Office of Pharmacy Affairs and HRSA. Beyond that, the statute is very brief in the regulatory requirements around the 340B program. The biggest limitation of the 340B statute is that it does not include the term contract pharmacy. This means that for covered entities, we have to go to a program guidance that was published in 2010 to have contract pharmacy defined. What's important to understand is that statute is legally enforceable, while guidance gives us insight into how HRSA and the Office of Pharmacy Affairs would like to see the 340B program run. Guidance, unlike the 340B statute, is not legally binding, and therefore the manufacturers have more discretion in how they are operating the program. Up until 2020, we saw manufacturers were willing to comply with the contract pharmacy guidance. However, successes that they had in other court cases that they brought against HRSA, including orphan drug exclusion, where they had successful wins in challenging other guidances put out by HRSA, emboldened manufacturers to challenge the contract pharmacy guidance as well. What we have seen is that since 2020, manufacturers have come out with their own individual policies on how they would like to see contract pharmacies run. Starting in 2020, we saw a few manufacturers who had decided to impose these restrictions. And as we anticipated, once a few were successful in this, more followed suit. At this point, we see over 20 manufacturers who have imposed contract pharmacy restrictions, with a handful of others using restricted distribution models. Each of the manufacturers has a different way that they navigate their restrictions. All are relatively similar. So a few of the elements that we see are the requests for data sharing, the limitation of the number of pharmacies that they will send medications to, and potentially a restriction of the mileage that those pharmacies can be from your covered entity. Another variation that we're seeing in these restrictions is that some manufacturers impose the restrictions on all covered entities, so hospitals and grantees. Others are opting to restrict hospitals only, while there are a handful who restrict for hospitals and health centers only. And it really depends on the formulary of medications that the manufacturers produce and the impact of purchasing by the grantee and hospital types who buy their products.
In addition to serving as a pharmacy services consultant, I'm also an employee at a health center. I got to see the impact of the manufacturer restrictions live and in person. When the manufacturer restrictions started, one of the first responses our health centers did was evaluate the impact to our patients. Our uninsured patients were impacted the most with these restrictions. When some of our uninsured patients went to their local pharmacies, instead of paying just a few dollars for their insulin and other life-saving medications, they were given a price tag of hundreds of dollars. So it really made an impact to patients' lives and their healthcare as a whole. Health centers had to react quickly to maintain the access to care for our uninsured patients to life-saving medications. But there was also an impact from our insured patients. Health centers rely on the savings generated from insured prescription claims to fund comprehensive services and reaching more eligible patients in line with the 340B program intent. One method we have used in community health centers to provide continued access to life-saving medications is to therapeutically substitute other medications. For example, with insulin, we were sometimes able to switch to a different brand that doesn't have a manufacturer restriction to provide that continued access to our patients. That continued to get harder and harder the more that we did it. As more and more manufacturers have added restrictions, it has been increasingly difficult to find affordable therapeutic alternatives for our patients. Throughout the changing landscape of manufacturer restrictions, our team has created a tool that helps covered entities identify the appropriate and cost-effective alternatives for their patients. One of the best solutions to the manufacturer restrictions has been and continues to be having an in-house pharmacy. In addition, having an in-house pharmacy enables our health centers to retain their 340B savings, thus allowing them to fulfill their mission in serving their patients.
We've established that navigating manufacturer restrictions is the biggest challenge to covered entities today. But what's the next step? How do we address this? How do we move forward? As your partner in the 340B program, we come alongside you in making the decision of whether or not submitting data is right for your organization. Once you've made that choice, we're going to assist you in the process. So we're going to help work with you and all of your contract pharmacy third-party administrators to understand what's the best way to get that information from their systems to the 340B ESP platform. That is the system that the majority of manufacturers who have imposed restrictions have opted to use to receive their data. When uploading data to the 340B ESP portal, you have the opportunity to provide as many fields as you would like, but there are actually only 6 required fields. These include the identifier for your covered entity, an identifier for the pharmacy, the NDC of the product dispensed and the quantity, the date the prescription was written, and the date filled. So those are the elements that we provide for the clients that we assist in uploading their data. Once data is uploaded, the next step within the ESP process is making sure that purchasing is opened and then stays open. So our team works hand in hand with the third-party administrator, the staff at 340B ESP, as well as the wholesalers and the manufacturers to make sure that everybody is doing their part in getting purchasing reopened as timely as possible. Once purchasing is reopened, as we continue the data submission process, often there are times where the purchases and the data submissions may not align, and there are a number of reasons that that could happen. The most common reasons that we see is that claims are what the manufacturers refer to as non-conforming. Typically means that the claim is more than 45 days old. The most frequent reason for a non-conforming claim is if you are processing referrals and your referral processor allows for a look back for original prescriptions, which are 340B eligible, but those prescriptions happen to be more than 45 days old. So what will happen is you have a qualification of an older prescription, again, which is 340B eligible, but then it leads to purchases that do not tie in with eligibility in that shorter time frame. So what we have to do is work with 340B ESP and the manufacturer to reconcile those differences. So our team assists with pulling the information to support the purchases and the utilizations, provide that back to 340B ESP and the manufacturers to help keep your purchasing open. Another element that's really important to consider is what happens when you have reversals of prescriptions within your 340B program. And so if you identify a claim in your review process, or if a claim is identified on the monthly review process that our team conducts on your behalf that results in a reversal, we also transmit that data to 340B ESP to make sure that all of our purchases and utilizations align. For instance, if you identified that you inadvertently processed Medicaid claims within a month and corrected those with the contract pharmacy reversing those claims, but that information had made it into your 340B ESP data, you have the opportunity to correct that with 340B ESP and the manufacturers, alerting them that you have resolved the issue and that no duplicate discount occurred. Our team will facilitate that process on your behalf within the 340B ESP portal. Manufacturer restrictions continue to be an ever-changing landscape. If you need help navigating it, contact us at FQHC340B.com.